about exercising after your CMC arthroplasty. So I am 5 weeks post-op. I like to exercise, so having surgery always creates some anxiety that I'm not going to be able to do that. So I've been back to my exercise routine since about 3 days post-op. So I just wanted to share with you guys a couple of things that you can easily do after your CMC arthroplasty. One of them is riding a stationary bike. Another thing you can easily do is walk, either outside or on a treadmill. And you can even manage to do an elliptical. Sometimes I put just my 2 fingers like this on the bar, and sometimes if it gets sore, I just do this. And one thing that's helpful when you exercise with your splint is I change out my sleeve, because when you exercise it gets really sweaty under here. So I have an exercise sleeve and then the one that I use for everyday activities so that I don't have a sweaty sleeve, which is gross.
Go for it.
I also like to continue with my weight routine even though this hand is kind of out of commission. So with my doctor's blessing, I try to do really light stuff in this hand and my regular weights in this hand. So for instance, I'll make this hand go through the motions with either no weight or with a very light weight. And I just do my regular exercises. And it makes me feel like I'm doing a little something on my surgical side, which makes me feel better. And I think it sincerely helps prevent atrophy from this arm. It can be hard to hold a weight, so I like a medicine ball because you can hold that in one hand or you can put it around, and then I can still do like my step-ups, like so. I can do squats with the med ball, like so. Even one-handed if this hand is too sore. I'm 5 weeks post-op, so it's getting to the point where it's not as sore, where I can rest things on this arm. I couldn't do that a few weeks ago. So with the TRX, it just gives you that little element of balance, and you can easily grip with these fingers that are free to do your squatting type exercises. I do not do any weight bearing exercises on the TRX yet. It's too painful and I don't think my doctor would approve of that. And I also use the Swiss ball to do like my leg exercises. Voila! Stuff like that, and hamstring curls. And I still do my planks. I wasn't able to do these for the first 3 weeks, so I started these at about 3 weeks post-op when my forearm wasn't so sore. But now I can put weight on my forearms with no pain at all, so I do. So don't let having a CMC arthroplasty stop you from doing exercise. I know for me it makes me feel a lot better that I can stay with my exercise program and not feel like I'm at home just withering away. All right, thanks. That's all for today.